How can you overcome dental anxiety? Well, first, you need to know that it is possible to overcome your fear. Then, you need to get motivated to make a change and commit to it. After that, it's actually quite simple, but don't mistake simple for easy. I'm Dr. Grant, and welcome to episode number 3 of Prevent. In the last episode of Prevent, we discussed why dental anxiety and fear is more harmful and complicated than it first appears. People who suffer from dental anxiety and fear have poor oral health and tend to have negative experiences at the dentist. It's a vicious cycle, but there is hope. For me, helping my patients through this fear is one of the most rewarding parts of my job as a dentist. So in today's episode, we're going to discuss confronting your fear, strategies you can use when at the dentist, strategies your dentist can use. Now, what lies ahead can sound very simple, but it is following through with these strategies that can be the difficult part. Dental fear and anxiety can affect anyone, and it can come from a bad experience at the dentist. Now, dentistry has come a long way over the years, so it's not always a bad experience that's to blame for these fears. For some people, it's a fear of injections or the sound of a drill. Others fear pain during a procedure. Some people have difficulty going numb or feel helpless when they lay back in the dental chair. Others are not even fearful of dentistry itself, but rather fear of judgment from the dentist for their lack of attendance or for their oral hygiene habits. Some people fear the cost or that they'll need a lot of work done. And yet others, they've just learnt this behaviour from observing their parents. In the end, figure out what the source of the actual fear is and tell your dentist about it. Talking to your dentist about your fear is step number 1. A good dentist-patient relationship is crucial for the management of anxiety, and once your anxieties are out in the open, they can be addressed properly. Good communication and trust is absolutely necessary for this process. But it's not all on you. Your dentist should empathize with your anxieties and communicate with you in an understanding, calm, and non-judgmental manner. After all, communication is a two-way street. Now, on to step 2. Bring your headphones to your appointment and play some music. It helps to put you in a relaxed frame of mind when you're listening to your favorite music. I've even had patients listen to a book instead. I think that's pretty cool. We have a TV on the ceiling in our surgery at Method Dental, and it can really help to keep your mind occupied during dental treatment. It works a treat with kids too. This technique can be difficult to learn, but in my experience, it tends to be the most effective. Use of the diaphragm for breathing reduces tension in the chest and provides more oxygen to the body. Take some time at home to focus on your breathing for a few minutes, taking a deep breath in and breathing out slowly. Try it now, like this. Place one hand on your abdomen and one on your chest. Breathe in, hold, and breathe out slowly. Performing deep breathing for a few minutes can lower your heart rate and make you feel noticeably more comfortable. Now for step 3. Communication is the key to overcoming dental anxiety. That's why the first step in all of this is to tell your dentist about your fear so you can address it head on. Now, your dentist should be empathetic and take your specific fear into account. They should take the time to talk to you, explain everything clearly, and go at a pace that you're comfortable with. Another communication technique that your dentist can use to great effect is tell, show, do, where we tell you about the procedure that's going to be performed, we show you how key parts of the procedure work, and then we do the procedure. This way you'll feel more in control and it takes away any uncertainty of what's going on in your mouth. I always tell my patients to raise their hand if they need a break or if they're feeling any discomfort. Performing great dentistry takes a lot of concentration, so raising your hand is an effective way to signal to me that you need to stop. Again, this gives you control of the appointment and it helps to increase your sense of trust in the dentist. Jumping in full steam ahead with treatment may not be the way to go. Phasing treatment over time has been very useful for many of my patients. The first appointment can be a simple consultation to address your concerns, to get to know your dentist and build up some confidence and trust in them. Your second appointment could be an examination and x-rays. I'll often try and do a simpler procedure at the next visit after that and gauge how well you're coping. With phasing treatment, we can build up your confidence in dentistry over time. Now, this is not a complete list of all of the things that can be useful. Specifically, there's cognitive behavioral therapy, medications, sedation, and even general anesthetic. These techniques tend to be reserved for the extremely dental phobic patients. In my experience, most cases of dental anxiety can be dealt with using the techniques that we've discussed today. It can take time, but the long-term benefits, they're worth it. But remember, just because these techniques are simple, it does not necessarily mean that they're easy. Be open to the idea of change, accept that it's going to take effort, and commit to overcoming your dental fear. Your dental team will be right beside you every step of the way. If you found this episode helpful in any way, please like and share it, because the more people we can reach, the more teeth we can save.